TB Day, and TB is identified as one of the world's most infectious diseases. It remains a critical public health priority in the global health community. Now, with a growing TB burden worldwide, the World Health Organization says that it is concerned about the number of people who remain marginalized from accessing life-saving TB services. Now, according to the latest global TB report, it is estimated that there are 9 million new TB cases and nearly 1.5 million deaths annually worldwide, with a further 3 million people that don't get access to essential TB services. Now, to speak more about this, we're now joined in studio by Malesela Maphoroma. Now, he is the coordinator at the South African National Tuberculosis Association, which is in Gauteng. Malesela, thank you so much for your time this afternoon.
Thank you.
Let's talk about the findings in terms of fighting the scourge of TB. What do statistics say? What exactly is, the war that is before you?
As a South African tuberculosis, we experience challenges. To start with, we see the number of people being infected with TB is increasing every day. So we are faced with a challenge with little resources. We'd like to call the government to come on, to work with us in fighting this disease, because it seriously shows that the battle is not about to be won.
Now, we often speak about curing the disease and how to fight this battle, but we hardly speak about preventative measures that people need to consider so to avoid any chance of contracting the disease. Take me through some of the preventative measures that people can just be aware of and try and practice.
The very first thing that you need to do is that, remember, most of us are infected with a latent TB, which is a TB that is not doing anything to your body. But through your immune system, you manage to survive every day without it, and it doesn't affect anything in your body. So the first thing that you need to do is to look after your immune system. If there's one member who's been infected with TB, it's advisable that the infants in the household needs to be tested for TB, and those who are in the house need to be screened for TB, just to check if there are no more damage being done by the person who's infected with TB.
Now, going back to statistics, I mentioned that there are 9 million new TB cases recorded, nearly 1.5 million deaths annually worldwide, yes, which are also recorded. Does this mean that people still lack education about TB, still lack information about the disease?
It's not that people don't know about TB. It's because some of the factors are the accessibility of medication, the behavior of the people being infected with TB, and most of all the communication between the people and the health sectors.
Yeah. Now, you mentioned accessibility to medical facilities and
yes,
medication.
Yes.
How are you addressing that problem? Because it's been a problem that's been going on in the country for so long, especially in our rural areas where you find elderly people suffering from the disease, child-headed households, children having to take care of their parents and having to walk distances to access medication. How are you addressing that problem?
Together with the government, SANTA, together with the government, we have initiated a program. Let me say re-initiated the program because it has been here for a while. We train people on DOTS. DOTS means daily observed treatment short course, which means that one goes to the community and help the TB patient to take their medication on a daily basis, making sure that they swallow those medications. Yeah. The government has initiated this program, and we are working together with this program, and hopefully in a few years we'll see some changes.
Now, speaking of your programs and campaigns as well, some of the initiatives that you're working on, I understand that this year's theme is Reach the 3 Million, Find, Treat and Cure TB. Take me through that, please.
What we do is, remember our minister launched mass testing this morning, and what we do as SANTA, we go to the community with the theme of mass testing. We go to the household and encourage them to go to the nearest clinic and get tested. And so far, we are finding statistics that there are people who are sitting at home who have never been tested, and they might be having TB from the screening that we're doing.
All right, thank you so much, Malesela. Thank you for your time and contributing to this conversation.
Thank you so much.
Thank you so much. Well, that was Malesela Maphoroma. He is the coordinator of the South African National Tuberculosis Association. We're just talking to him about World TB Day and what actually they're doing, what programs they have in place to ensure that they fight TB.